Hey everybody, we'll get going now. Good evening. Thanks for joining in. I'm Dr. Wes with McIver Clinic. And thanks for joining this Zoom conference, kind of community health talk that we wanted to put together. This is a very exciting time for men's health, specifically prostate and prostate health. Tonight I'd like to share with you some information on some state-of-the-art office-based procedure that is really revolutionizing how we handle and manage BPH. I appreciate your time and effort that you've made to join the discussion. We do have availability later at the end of the talk to handle some questions. The best way to submit those, there's a chat portion of on the Zoom that you can send those in, and we'll have a moderator send those to me. I do recommend, obviously with patient personal confidentiality and HIPAA laws, we'll try to keep these as generic as we can with the understanding any kind of personal questions that you have. We clearly want to address those, and we'll do that in a one-on-one basis in our office. So what we'll do is go ahead and get going with our discussion. Obviously, we're talking about an enlarged prostate. Today's agenda, we're going to cover several things. First and foremost, what's the importance of the prostate? Why is it there? What is BPH? What's that acronym stand for? How do we diagnose BPH? What are our treatment options in general? And then we will spend some time on the UroLift system, because as I said earlier, this is the state-of-the-art that's really revolutionizing how we manage urinary symptoms. So what's the importance of the prostate? Anatomically, this is a walnut-shaped gland at the base of the bladder. It surrounds the urethra, so it comprises a portion of the urethra. Its function is it produces a fluid that helps transport the sperm during ejaculation. So it makes a majority of a good amount of the semen fluid that is used for reproduction. Over time, how does our prostate act? Well, there are two real areas of growth. We're all obviously born with a prostate. When we hit puberty, under the control of testosterone, we begin to see growth in the prostate. And that growth slowly but surely continues from our teenage years all the way to death. One of the interesting questions is why do some men have a larger prostate than others? We don't have all of those answers, but we do know it's under the influence of testosterone. What are some prostate conditions? So we're talking about prostate health in general. Prostatitis, that's a swelling and inflammation of the prostate. Typically that has different symptoms associated with it. Obviously prostate cancer, it's a very common cancer among men. It's typically slow growing. And then enlarged prostate, and that's much more common than prostatitis or prostate cancer. Each of these disease processes affect our prostates differently and how they present, the symptoms that they present, and how we manage those. Having one doesn't exclude you or preclude you from having any of the other ones. Yes, you can have prostatitis and have an enlarged prostate. Yes, you can have an enlarged prostate and develop prostate cancer. Some interesting information on the progression of prostate growth. These are some graphs that show how, as we age, a majority of men have BPH or prostate-related symptoms. 40 million men each year in the United States is affected by BPH. And by the age of 60, 70% of us have prostate-related enlargement. And by the age of 80, we all have it essentially. So what is BPH? What is benign prostatic hyperplasia? And it is the medical term, mind you, for an enlarged prostate. And it is a non-cancerous enlargement of the gland. And again, like I mentioned earlier, it doesn't mean that you have prostate cancer. Typically, prostate cancer affects portions of the gland in a different way than prostate enlargement does. PSA, which is a screening tool that we use for prostate cancer, can increase with both BPH and prostate cancer. The more prostate cells you have, meaning the larger your prostate is, oftentimes there's a correlation with an enlargement. So many men have an enlarged prostate, they have an elevated PSA, and they don't have cancer. Here's some anatomical drawings that I think are important to take a look at. As this prostate enlarges, it does lead to urinary problems, and it's really a plumbing issue, so to speak. As the prostate enlargement and really where the prostate enlarges can affect and restrict the outflow of urine. The bladder is a muscle, it squeezes, and it's squeezing the urine through a pipe essentially. And as that pipe narrows, as the radius or the circumference of the pipe decreases, then that can lead to urinary symptoms. What happens if we don't treat BPH? What happens if we ignore our symptoms? Well, there can be, and there's more and more literature supporting bladder damage. The bladder is the elastic muscle that squeezes. It provides the force to expel the urine from the urinary tract. As you can see on the diagram to the right, as that prostate continues to have to essentially work harder, right? It's having to provide more of a contraction to squeeze through a narrowed, obstructed urinary flow. It can change how the bladder works. And in some situations, the bladder can fail. It's different than a bicep muscle or a quadricep muscle that can be rehabilitated because of the smooth muscle fibers of the prostate. Once it reaches a certain point, it can't squeeze anymore. Normal prostate, enlarged prostate, and significantly enlarged prostate are diagrammed here fairly well. And on the slides below, that is a cystoscopic view. So this is what we see as urologists when we're evaluating patients, when we can determine how significant the restriction or the obstruction is. Obviously, the lower left on the bottom slide, you see a wide open urethra. That area that looks dark is essentially looking into the bladder. The middle slide, we start to see some enlargement, some encroachment of the prostate tissue on that channel. And then in the far lower right-hand corner, we see an obstructed urethra. We see an obstructed prostate. And as you can see, the urine is having to work its way through that area. So recognizing the symptoms of BPH, patients can have different presentations with these symptoms. Not every man has one or two symptoms. And sometimes deciphering what these symptoms are and if they're related to BPH is really key in how we determine treatment. Frequent urinations, multiple trips to the bathroom, the sudden urge to go. Hey, I've got to go. I can't hold it. I mean, I need to go. Difficulty urinating, kind of the pressure, the starting and stopping, a weak stream, you know. Some men that don't want to use urinals anymore, they want to sit down because the urine leaks and drips. The incomplete elimination of urine, not feeling that you're completely emptying out, have to get up during the night because of not feeling of complete empty, and then the starting and stopping. You can have a litany of these. You can have 2 of these. You can have 3 of these together. And this is how the clinical presentation of some of the pictures you saw. And the real issue with prostate enlargement is the quality of life, how it affects you, okay? Avoiding travel. You know, I've had several patients who it's affected them wanting to play golf with their friends or recreational activities. I've mentioned before using the stalls instead of urines. Bathroom hunting, right? Knowing that wherever I am, where's the restroom? Where do I go to the restroom if I have to go or if I feel like I need to go? And then the big thing is the sleep patterns. And that was one of the things that a lot of data is supporting. As our sleep is interrupted, okay? As our sleep is interrupted, as we age, it can lead to some cognitive some balance issues. And so that sleep is very important. How is it diagnosed? If you come to our office at the McIver Clinic, we'll do a medical history, a physical exam, including a prostate exam that just determines the size of your prostate. Sometimes we'll do a bladder ultrasound, which is a very easy diagnostic tool where we scan your bladder with a little ultrasound probe to see if you're emptying or not. And a real important tool that's really evolved over time for prostate treatment and prostate health is what we call an IPSS score. I know we've linked that to the invite. Hopefully some of you were able to fill that out, and we'll go into some more detail. But the IPSS score has become an invaluable tool for urologists to, number one, to see how bothered your symptoms are, how bothered you are by them. I can go into a patient room and say, how are you doing? Oh, I'm doing okay. Okay, well, that's good. But once I see this form, it really cuts through to you, to what's happening in your life, how this is affecting your life. It's also a very useful tool to see how we're doing if we're needing treatments, whether that be medications or interventions, or we can compare where we were, where we are now. And so it's a very useful tool. And then obviously, how much of a bother is it? How bothered are you by these urinary symptoms? And bottom line is, that's really the bottom line. You know, how bothered are you? These are some optional studies that we could discuss. Obviously, this is all individualized. A uroflow test is where we urinate into a special commode that has an adapter that really figures out your flow, how strong of a flow you had. And there is a correlation between your flow rate and how much restriction that you have. A transrectal ultrasound, which is determining the actual volume of your prostate, has been very useful in determining what's the right treatment and how enlarged is the prostate. It's essentially a true volume of your prostate. And then the cystoscopy, you saw some of the pictures earlier tonight, that gives us the anatomic evaluation that we need. And both of these procedures take less than 15 or 20 seconds. The cystoscopy is, we use the lidocaine jelly to numb the urethra, and a very tiny, small camera. And really, I've asked men, what does it feel like? And they just say, it feels like I really need to urinate. And it's about a 15-second, I really feel like I need to urinate, and then it's over. But it really gives invaluable information, again, to personalize your treatment plan. Okay, shifting back to the IPSS score, the International Prostate Symptom Score Index. This really gives us a great gauge of where you are. I'm not going to go through all the symptoms on the left. We've discussed those, but really we add those up and that gives us a score. 0 to 7 considered mild symptoms, okay? 8 to 19 is considered moderate, and then 20 to 35 are considered severe symptoms. And then we also look at your quality of life. You could have an IPSS score of 6, which is considered mild, but it really affects your quality of life. Well, that's important for us to evaluate. So regardless of your score, okay, any kind of symptom that's causing bother, that's affecting your quality of life, is important to us. I want to review treatment options next, and we'll kind of go down the paradigm from least invasive to the more invasive and go over the pros and cons of all of these. Different patients require different interventions. Again, we really are moving to personalizing this, and it's clearly not a one-size-fits-all. So let's start with watchful waiting. Obviously, we're not doing anything, right? There's no surgery. We're not prescribing drugs. There's no side effects. Hey, I've got some minimal symptoms. Let's see how you're doing. The disadvantages, I may have to modify my lifestyle. I may have to get up 2 or 3 times a night. I may have to, bathroom hunt while I'm out, shopping. It's very unlikely for whatever your symptoms are to improve on their own, okay? So if you say, well, I'm not really bothered, I want to watch this, that's fine. I just don't expect it to get better. And then obviously the big risk is, do these symptoms get worse? Do they deteriorate over time? Medications, no surgery, right? There is improvement with symptoms. There is data that shows that men improve with medications. The question is, do they provide enough relief? These medications also have side effects, and that's really the shift now is looking at, are the urinary benefits that these medications provide worth the side effects? And the big side effect that's out there is what we call the retrograde ejaculation. Flomax is considered the kind of the first line treatment for medications, if we want to try medications, but it does lead to retrograde ejaculation. There's data that it also can lead to dizziness, lightheadedness, and so it's not a completely benign medication, but there is a patient population that does well with that. And you look here on the disadvantages of those medications, and I talked to you about those, especially about the Flomax. The Avodart shrinks the prostate over time. Alone, it's kind of fallen out of favor for a first-line treatment. There are some sexual side effects. It can affect libido. It can affect erection quality. And so those are some things that you should know about. And then obviously the cost, right? So taking the medication every day for the next 10, 20, 30, 40 years of your life, it does add up. The herbal remedies, I know at McIver Clinic and most urologists, we're not big proponents of herbal remedies, and it's not because we're anti-homeopathic medications. It's because there have not been well-studied research papers that have shown any clinical benefit to all the herbal remedies. The super beta prostate, the saw palmetto, watch watch NFL football or talk news on Sunday, and they'll be out there. They're expensive, and there's no data behind them, and they're not FDA approved, more importantly. So we don't know what kind of side effects these could cause. UroLift, and this is really one of the things that we're really excited to share with you. What are the advantages of this procedure? And we'll get into some more detail about the procedure and what to expect and how it works. It's done in the office. Okay, it can be done in the office. And more importantly, and I think the big point here is the preservation of sexual function. It is the only FDA-approved procedure for prostate enlargement that has absolutely zero effect on sexual function. Sex drive, ejaculation function, quality of erection, that is not affected at all. It is the only treatment out there that can claim that, and that's FDA approved. The rapid return to symptom improvement, okay? The almost immediacy that we see the improvement in the urinary symptoms is very intriguing and very appealing to patients. There's very little downtime. A lot of my patients are very active, or whether it be golf or tennis or enjoying living in this area, and they don't want to be down for a long period of time, and this affords that. Most men do not require a catheter afterwards. And a lot of the other procedures that we will discuss, you absolutely have a catheter, and that's a tube in the penis that drains the bladder to allow everything to heal. Okay, so another advantage is clearly not having a catheter in the bladder. And then most importantly, it provides durable results. Okay, the clinical data has shown that. The follow-up data, the durability of this has been proven, which is very exciting. Disadvantages, right? Any kind of procedure, there's pros and cons. There can be some discomfort during the procedure. You can really have that urge to urinate when they're doing the procedure. This is typically done under some type of sedation, but there can be some discomfort, especially immediately after the procedure and during urination. The first few days Men typically say, hey, I felt it when I urinated. Expect to see a little bit of blood in the urine. And I don't really call that a disadvantage. Any prostate procedure that you have, you're going to see blood in the urine. There's no way around it. So some blood in the urine is expected. I always tell my patients blood is like food coloring, okay? It takes a drop or two of blood to turn your urine red. And so it will obviously look more alarming than it is. The potential increase in urgency. And essentially, the way I describe this to patients is the bladder has been working, okay? It has been trying to empty and squeeze as best as it can. Now it's a wide open channel. And so there is some reacclimation initially because of the new anatomy, so to speak. Most men, that resolves within 3 months. Most of the men who have some of that increased urgency, it resolves in 3 weeks and almost entirely at 3 months. Moving on to some of the more invasive procedures. These are some of the what we call the thermotherapies. So using heat and steam-based therapies to treat the prostate. Microwave therapy, tuna, or radio frequency ablation and resume, and they're essentially the same thing. They're using extremely high temperatures to essentially cook or melt away that prostate tissue. It can be done in the office. That obviously is an advantage. One of the things that we see with some of the thermotherapies is the longer term discomfort, right? So if you get a burn or a temperature treatment, it takes longer for that tissue to heal. You obviously blood in the urine, there can be some urgency. The big thing with the resume is the catheter in the bladder, okay? Most men have the catheter at least 5, some 7 days because of all the swelling from that heat therapy. And then obviously the potential for the sexual dysfunction, as we talked about earlier. That's very important to a lot of our patients. When we talk about the retrograde ejaculation that some of the medications and some of these other modalities cause, that's a dry orgasm. When you have a retrograde ejaculation is when I have an orgasm, nothing comes out. And that is a potential with these other therapies. And as I mentioned before, UroLift is the only FDA approved procedure that you have no risk of that at all. Laser or TURP-like surgeries where the extra prostate tissue is resected or vaporized. Again, a good procedure. There's good data with the outcomes and the improvement in urinary symptoms. There's a low retreatment rate, lasts a long time, but typically this is done in the hospital. You're put under anesthesia. In some situations, you have to be kept overnight in the hospital. Catheter for days, you're talking at least 3 to 5 days with the catheter. 6 weeks of restrictions of your activity, right? So we're not talking about playing golf or going on a bike ride or any of those things for a while just because of the post-operative care. 10% have erectile problems. About 10% for reasons that we're not exactly we don't quite understand, can have some reduction in their erection function. And then obviously, as we said, the dry orgasm, right? So you've got about a 40 to 65% chance of having a dry orgasm moving forward. The incontinence rate, where I leak a little bit of urine, is low, right? It is low, but it's not negligible. And about a little less than 10% of patients, because of the heat that is used or the treatment of the TURP treatment, can have some scar tissue that can develop in the urinary channel. We've covered kind of the gamut of options from not doing anything to medications, the UroLift, and then some of the other heat therapies and the TURP and green light. I really want to focus the rest of our time on the UroLift system. And as I said before, if you guys have some questions, just send them in through your Zoom chat box on below and we'll get to those. But as I mentioned before, this is really changing kind of the paradigm on how are treating BPH. So how does it work, right? What does it do? So obviously the first screen, you see the enlarged prostate. It's restricting the urethra. The device, the camera is put inside the urethra, and it's located on selected areas of the prostate where the implant is deployed. So the deploying of the implant essentially spreads the prostate tissue away. It pins it away. Think of drapes where they are kind of tied away to expose the window, and that's essentially the same thing that we see here. It's a very small implant. This obviously isn't the size of the implant, but if you compare it to a dime, you have a stainless steel component, a suture component, no different than if you had a hernia repair, the same type of suture. And then there's a capsular tab that seats the prostate and allows the compression of the prostate tissue to open the prostate urethra. Here is a animation that I want to show you, and this actually shows you exactly how this works. So here you can see the device is placed, the implant is seated to the outside of the prostate, and it compresses the prostate tissue. Again, no cutting, no heat therapy used, opening the prostate tissue. So we have the before, obviously the restricted urethra, and the after. And then here's a cystoscopic view of that prostate tissue being opened. And this is a cystoscopic. This is actually a camera that was the before and after. And you see that pink tissue that's restricted the urethra, and then now wide open tissue. If you look on the slide to the right, that open channel, right? That open channel that allows the urethra, pardon me, that allows the bladder to eliminate the urine. What would I expect after having this procedure? Typically after the first week, the swelling resolves, the symptoms improve, and they likely continue to 3 months. Typically in my patients, I'll have them come back to the office 3 weeks after their procedure. We look at their IPSS score, and I've really been amazed at how quickly these results are clinically manifesting themselves in the patients. Most common side effect, like I said, the first few days you see some blood in the urine. There can be some irritation when urinating. We obviously send you home with medications that can help really ameliorate these symptoms and minimize these symptoms. The urge that we talked about is sometimes that you see initially as essentially the bladder becomes recalibrated with this open channel. Most are mild to moderate in severity. Within 2 to 4 weeks, I mean, they're essentially gone, right? And the data has shown this out to at least 5 years of this symptomatic improvement. It's recognized and reimbursed by Medicare nationally, right? So Medicare covers it. Obviously, if you have a secondary insurance that covers certain parts of it, there can be copays, but for the most part, we've had no issues with this from a reimbursement standpoint because it's FDA approved. Obviously, our office is going to work with you. If this is the right thing for you, all of the prior authorization and all the financial responsibility, if any, there's no surprises there. We would want you to know, hey, this is what to expect, and we have a dedicated person that works on that with you individually. Any other insurance questions, if you go to urolift.com and look under See Insurance Coverage under the For Patients tab, is very, very beneficial. I know for the patients in Northeast Florida that we see, we've had really no issues at all with any type of coverage for this procedure. What's next? We want to see you. We want to talk about these things in a little more detail with you. We're excited about having the availability to offer this to our patients. A lot of patients were hesitant because it was a big jump, right? I'm going from taking a pill to having a pretty significant surgery that has significant sexual side effects. And now with this in the market, this has really been a game changer. And so now men are getting off medications. They're getting off these medications that have the side effects and the cost. And inevitably, their symptoms are much improved on after the procedure than they're anywhere were with the medications. And so we obviously want to see you. You can call us for an appointment. There is a link on our website. You can email to request an appointment, and we would want to have somebody to meet with you. Pay attention to your symptoms, right? That IPSS score is invaluable. It really kind of lets you know, it's an honest assessment of where you are. And that's something that we would want to talk to you about. And then obviously we want to find the right solution for you, right? I mean, this is about finding the best solution for you. We want to help improve your urinary health, your quality of life, minimize the side effects, and keep you active. Now it looks like we do have some questions that the moderator has sent me. And then this is our appointment line, 904-355-6583, or if the link in the chat, mention the UroLift in the comments section. So let me just send these over. So we'll just go over these question and answer. And again, we'll cover these. I do want you guys to know that anything particular involving you, we want to handle that in a very secure and confidential setting. And so please feel free to reach out to us and we can get that set up for you. So again, guys, thanks for participating. We'll answer some of these questions that have arisen during these health consults and then from the chat. So first question, if I am doing fine on my medications, should I still consider the UroLift procedure? Well, I clearly, as I mentioned to you before, there is a push to look at other options other than medications. And I know I have patients that don't want to be on the medications. There are obviously side effects from the medications. There are the costs. You absolutely are a candidate for the UroLift if you're taking medications. That obviously means that you have some urinary symptoms. You have symptoms that are bothersome enough that either your primary care doctor, you mentioned it to your primary care doctor or to your urologist about these urinary symptoms. So absolutely we can. Can I still have a UroLift if I've had another condition like kidney stones or if I'm on active surveillance for prostate cancer? Without a doubt. Kidney stones, other urologic conditions are really independent variables. If you are watching your prostate cancer, if you've had radiation for prostate cancer but still are having these urinary symptoms, this is an excellent option for you to consider. It doesn't exclude you or preclude you from having any other urologic interventions. What would happen if the prostate continues to grow after the UroLift? Is this permanent? If you remember back on initially during the conference, we had a slide that says once we hit puberty, the prostate continues to slowly grow over time. And the prostate can continue to grow. It's going to happen slowly. I can tell you that the retreatment rate is very low, but we don't hamstring ourselves from having any other options available if 10, 15 years down the road your prostate's enlarging and you need something more aggressive, right? So this doesn't preclude us from having something if the urinary symptoms are bothersome. Are anticoagulations contraindication with UroLift procedure? No, they are not. Obviously, we would coordinate that with your cardiologist or hematologist, and typically we can pause those just for a bit for this procedure, right? I've had several patients on Plavix, Coumadin, heparin, some of those things that we've been able to safely pause those medications and complete the procedure. Can the implant be removed? Yes, it can. It can be removed. The indications for that obviously would be something that's extremely unusual. If the prostate continued to enlarge, they can be removed, and it's done in a very simple cystoscopic manner. We're not talking about removing your whole prostate or any invasive intervention for that. Can I have an MRI? Yes, you can have an MRI. You can go through security at the airport. There's no problems there at all. How do I know if I'm a good candidate for a UroLift? Well, hopefully this community health talk kind of lends some information on that. I think if you're not happy in any way, shape, or form with your urinary symptoms, whether that be by I'm taking medications or I'm not taking medications, then you are a candidate. Two more questions, and then we'll wrap it up. What makes the UroLift unique? The uniqueness is absolutely related to its ability to avoid sexual side effects, avoid issues with worsening of erections, and providing a long-term improvement in your urinary symptoms. That's what makes it unique. It's office-based, okay? There's immediate results. So all of those things play a role. Another question was, are they expected to have permanent results? Absolutely. This isn't a, this isn't a procedure that's done to pacify you for a year or two. I mean, this is done to fix the symptoms. The retreatment rate is out there for all prostate procedures, whether that be a green light or a TURP or a resume or any type of therapy. There's a small percentage of patients that need retreatment. But those numbers are not significant in the UroLift cohort of patients at all. One final one, does this affect my, are there other physicians at McIver Clinic that perform the UroLift? Absolutely. We have several well-trained physicians that are dedicated to and have dedicated themselves on providing this technique at an absolute top-notch level. The extra training, the dedication to the procedure itself, ensuring that we're getting the right clinical outcomes, comparing ourselves to other leaders in the field regarding the UroLift. We have several of our providers that are excited to offer this to you, and would be more than happy to meet with you and talk with you. Okay, anything else from our panelists? I think we covered almost all of those. Just a quick word. Again, I wanted to thank all of you for sharing a bit of your time with me. I value your time. It's important, and I appreciate the time that you spent to letting me have a discussion with you. We're here to help you. If you have questions, if you have concerns, if you want to go over this in more detail, please reach out to us. We're here, and we really want to improve your urinary health and improve your quality of life. Our phone number is 904-355-6583. And if you call in, let them know you want to speak with one of our physicians about the UroLift. Thank you all for your time. Good night, and hope to see you soon.